Greetings and welcome to those of you from across the United States and countries all over the world to the Public-Private Partnership Security and Resilience Seminar Series, Session 2. We're so glad that you could be here with us today. My name is Kenya Cummins, Communication Specialist for G&H International Services, and a member of the Public-Private Partnership Security and Resilience Seminar Series planning team. Please refer to the slide for the agenda for the day. The series goals are to provide business owners and operators with best practices, planning resources, and tools for security and resilience. Today's session is sponsored by the Idaho Office of Emergency Management in partnership with G&H International Services, the Oregon Department of Emergency Management, and the Cybersecurity and Infrastructure Security Agency, known as CISA, and Albertsons Companies. This session is being brought to you as part of the Public-Private Partnership Platform, also known as P4. P4 serves as a one-stop shop for private sector partners to engage, collaborate, and communicate with the program managers in Oregon, Washington, Idaho, and Alaska. For the next 90 minutes, our speakers today will share lessons learned and best practices from businesses that have developed innovative and socially engaging programs to address the complex issue of homelessness. This session will help businesses create forward-thinking plans and initiatives to tackle the multifaceted challenges homelessness presents for their operations, customers, employees, and the communities they serve. Today's learning objectives are as follows. Identify houselessness complexities, including stereotypes and realities. Understand the impact of houselessness on retail security and learning crime prevention best practices, and utilizing technology and logistical support effectively to facilitate healthcare access and support for underserved populations. Before we begin, let's go over some housekeeping items. To ensure a smooth experience, we've muted all participant microphones to prevent disruptions and background noise. Please be sure to mute your microphones for the duration of the session. Due to the large audience today, we won't have an open chat function. Instead, we'll host a facilitated Q&A session at the end where our instructors and partners will address your questions. Please use the Q&A feature to ask questions relevant to the topic. We'll do our best to cover them all. If you encounter Though we don't anticipate any interruptions, in case of severe presenter connectivity issues, we'll either re-engage or move to the next agenda item promptly. After the session, you may complete the knowledge assessment for ISET CEUs. Additionally, recordings of all sessions will be available for playback at your convenience. As an ISET accredited provider, G&H is excited to provide ISET CEUs for this seminar series. In compliance with ANSI and ISET standards, to qualify for ISET CEUs, attendees must be present for the entire live session and achieve 70% or greater on the post-event knowledge assessment. If you have any questions about the ISET CEU process, please contact G&H at training@gninternational.com or 202-955-9505. Additional information about ISET or ANSI ISET standards is available by email at info@iset.org or online at www.iset.org. G&H proprietary interest policy requires instructors to disclose any vested interest in products or materials used in the learning event, including royalties or profits from endorsements. Please contact G&H with concerns about policy compliance. G&H anti-discrimination policy ensures a learning environment free from sexual or any form of unlawful harassment or discrimination. Contact us directly with any concerns about policy breaches. G&H is eager to collaborate with you in continuing education and training with ISET CEUs. Our first speaker is Dawn Lin. Dawn serves as the Director of Crisis and Business Continuity Management for Albertsons Companies. With over 20 years of experience in the food sector, Dawn specializes in crisis and business continuity management. His diverse background spans law enforcement, power, and telecommunications, focusing on national security and emergency preparedness. Welcome, Dawn.
Well, hello, everyone, and it's good to be with you today. I'm going to be providing a private sector view and the impact that we see there. And so welcome to our seminar series. As has been mentioned, our topic today is on the topic of homeless. Other terms you may hear are houselessness, unhoused, unsheltered. And if you're in Europe, you'll find terms like rooflessness, houselessness, homeless, insecure housing, and inadequate housing. Having business locations in 35 states in the District of Columbia, it's not always easy to find that one common term in such a broad audience. So please bear with us. And there's always the possibility that we may switch between different terms. But no matter what the term is, it is always about people. To get us started on this journey today, we need to level set on the bad and the ugly that we see and experience in most private businesses. Some businesses experience more, others less, and it will vary between different areas or regions. No matter which term you use or where you are located, it is a growing problem. In 2023, the rise was like 12% in the population of the homeless. I encourage you to stay with us, as the latter portion of our presentation today will be about the good. But so let's look a little bit about the bad and the ugly. Slide, please. So a couple of ground rules for today. We always want to be prepared. We want to view everything from all perspectives and look at the real world, and then finally be able to make those tough decisions. I will also pass on that I've learned that I don't know is sometimes a proper answer for the moment. Currently, most, if not all, solutions to private sector and to the problems we're going to discuss today is one of law enforcement. Is there something better? I don't know yet. And at the same time, I sure hope so. We can, of course, start the discussion, which is why we're here today. Slide, please. The perspective that I'm sharing today is from the viewpoint of having been a police officer, being a first responder for far too many disasters, and as a private business practitioner from multiple sectors, the last 20 of it having been in grocery and pharmacy, the food sector. Finally, I'll be sharing the shared experience of many of my private sector peers who are living these impacts every day. Slide. Across the nation and the world, shopping carts are known by many different names, and I've included a few of those names for our national and international audience. When viewing a scene like this, most folks automatically think homeless. In the private business and law enforcement community, thoughts go to loitering or vagrancy, and we're going to be talking about that. I will pass on that shopping carts cost about $225 each in volume, and milk crates, which you'll see that our person is sitting on, cost about $10. The elements of the crime make it a petty theft when either one of them are taken. When people commit larceny or theft, they do so for different reasons. One is opportunity, financial gain, desperation, or revenge. And we know opportunity and desperation is probably the main factor. And in order not to make it a people problem, as I've mentioned before in the slide, the locking wheels that I'm referring to on the shopping cart do so at the perimeter of the property. It is targeted at keeping the carts at the store location, limit the opportunity for them to be taken, and lower the encounters with those that do take them. There are other solutions out there, such as one that watches via camera and has talk capability, telling folks it's time to wake up, the store is about to open, and reminding all of everyone to be a good citizen and take their belongings and trash with them. These stop the impact, but it didn't really address the problem. Slide. I'll often get asked about the strangest cases and the worst cases, so I'll share one with you. This is the most bizarre case that I've ever heard of. The person that was living in this sign on top of a store had a coffee maker, a heater, and a computer, and they camped store top for almost a year. The most severe or tragic cases being people that were just sleeping, but they slept in dumpsters, compactors, or in docking areas, and usually with not a problem, but in more cases than we like to talk about, resulting in serious crush injuries or fatalities. So there are some valid liability or safety concerns. There are some that just consider it as NIMBY, not in my backyard. They just don't want it there. We'll discuss some other specific impacts shortly. Slide. So real quick, let's talk about stereotypes. There are several stereotypes and misconceptions about homeless people that are prevalent in society. Here are the most common ones. As you see, it runs from everyone is a criminal. They're all mentally ill. They all have substance problems of some sort, and they choose to live this way, or they're just plain lazy. As you might imagine, the results that you'll come up with if you carry this type of view. So rather than focusing on the stereotypes, let's look at some of the real impacts that we experience. Slide, please. As we look over this short list, we see that this problem is not strictly that of being homeless, but that there are behaviors or acts occurring that do not mix well in the business environment, at least from our point of view. And some of it is for no other reason than just being there. And for other items on the list, we see crimes like loitering, vagrancy, vandalism, theft, and arson, just to name a few. We're talking about private property that grants public access only within limited parameters. It may be time of day of week, certain areas or rooms within a building, etc., but only when wearing shirts and shoes. And I kind of say that in jest. I added the no shoes, no shirts, no service, because that originated as a reaction to a problem. And it was basically to allow a business to exclude some people based on their practice, but not from a class or group standpoint. At one time, having no shoes usually meant you were poor. I'll kind of stop there with this thing, but I think that you see the point. Slide. So this is not the Red-Green show from the late 90s to the early 2000s. We won't hear Red giving out sage advice from behind his workbench, talking to us about coping with changing society. And certainly duct tape is not going to solve our problem. This part of this survey here was behavior-based. It was based on displaying aggressive, quote unquote, street behaviors, with the green guess indicating people that belong there and red guess indicating street behaviors and where the encounters took place. And this survey showed that 50% of the time, the folks were found in their or a vehicle. 43% of the population were found at a store entrance or exit. And by exit, I'm not really talking about the back of the building. And 7% were found in the store itself. In the food sector, we track incidents in the building and those incidents outside of the building. And this is usually out in the parking lot. However, we track by type of incident. We don't break it down to the front of the store versus back of the store. In this cases, the offenses were more likely panhandling, sleeping, or verbal in nature. Slide. The Loss Prevention Research Council also categorized unwanted behavior into 5 different areas: aggressive street behaviors, sleeping, panhandling, drug and alcohol abuse, and theft. The study noted that fear of crime could adversely affect several aspects of retail, such as the shopping experience, customer traffic, and employee performance. The thefts also did not quantify shoplifting, boosting, and organized retail crime, and we'll talk about those in a moment, nor did it cover the type of vandalism that we often see at the back of the store. Slide. In many parts of the United States, it is illegal to be homeless due to laws and policies that criminalize life-sustaining activities. And these are activities that are carried out in public spaces. These activities can include sleeping, resting, asking for donations, and even simply just existing in public. A report by the National Homeless Law Center tells us that 47 US states have laws criminalizing homeless people engaging in life-sustaining activities. Again, it is important to note that being homeless itself is not a crime, but the activities associated with homelessness can be penalized under certain laws. These laws can lead to homeless people being cited, fined, or even arrested. And having a criminal record can make it harder and difficult for people to secure employment, housing, and other resources, making it really difficult to even exit homelessness. It is also true that these laws and policies vary widely from state to state, and even from city to city within the same state. So it's been really difficult for especially large companies with a huge footprint, a nationwide footprint or an international footprint, to standardize on solutions. Slide. So make no doubt about it, loitering and vagrancy does have an impact on businesses. And here are the key points. From a cost perspective, unsightly messes or possibly property damage. From a brand perspective, it does make others feel unsafe and deter customers from visiting. Customer experience, you can scare away legitimate customers and discourage folks that want to visit your place of business. It can make employees feel unsafe. It also impacts employee well-being. The fog and stress of dealing with these impacts daily, and an increase in crimes, because some may resort to theft, or you could be on the receiving end of vandalism. And then finally, organized crime. So speaking of organized retail crime, ORC or ORC, this is hitting us hard. And we have evidence that crime groups are reporting from the loiterers to boost, another word for stealing products from the store, promising easy money for their effort. Some are employing violent means against these same groups in order to get them to steal. Combine all the large and small companies' losses together, and that means billions with a B in loss, all which increases the price of goods, services, and products to the consumer. We also have to remember that handling these situations can be a double-edged sword for business owners. Failing to deal with loiterers, particularly those who are homeless, in a respectful manner can lead to liability and public image problems. Therefore, it's critical for businesses to find effective approaches to prevent or deal with vagrancy and loitering. Slide, please. As I close out my portion of the seminar, Addressing the root causes of homelessness is something viewed as out of the hands of retailers, but we can help address its impact to our stores and by extension the surrounding communities, but we can't do it alone. By considering technologies to help guard the physical store property and empathy-based training to help employees better handle situations without a major disruption to customers, retailers can deter adverse behaviors in a way that preserves dignity for all involved. I looked up FEAR as an acronym and found over 40 listings. Many of us will recognize forget everything and run and face everything and rise. Today, as we delve a bit more on this topic of homelessness, perhaps we'll just consider some of the bad and ugly to be false evidence appearing real. And again, we're in this together. So at this time, we'll go back to our moderator, Kenya, and thank you for being here.
Thank you, Don. Our next speaker is Kara Steele. A crime and intelligence analyst with 23 years of experience, Kara works at the Oregon DOJ's Retail Theft Unit. She specializes in data analysis for combating retail theft and has a background in drug and criminal organization investigations. She's a certified crime analyst and holds a bachelor's degree from Oregon State University. Welcome, Kara.
Thank you. All right, you can knock through those next couple of slides. Thank you. So today I'm going to discuss just a few things, and thank you for that introduction. And I'm going to review some national patterns and trends of shoplifting and houselessness. I'm going to talk about how we got here, and I'm going to share some best practices. Just like Dawn mentioned, I just want to say that I'm going to use some of the descriptive words for houselessness interchangeably. Oregon has sort of transitioned to houseless, but there's a lot of different ways that we can describe it. But at the end of the day, it just means that we're talking about who doesn't have access to stable housing and is met with the utmost compassion and dignity to that person. Slide. So retailers are facing unprecedented levels of retail crime and violence. The Loss Prevention Research Council indicated that retailers believe that retail crime problems and homelessness are related. The issues are complex and much is unknown. Agencies such as Oregon Department of Justice and units like the one I'm in are working to better address the why behind retail theft crimes, which will lend to better problem solutions. It is a team effort, though, and due to the complex and transitory nature of the people and the crimes, it makes solution-based policing more difficult. The National Retail Federation reported in 2023 that 72% of the participating retailers believe that homelessness was a higher priority than in 2022. The National Retail Security Survey found that retailers lost an estimated $94.5 billion nationwide to shrink alone. The U.S. Department of Housing and Urban Development do regular national reports on chronic homelessness. The data analyzed indicates that homelessness is not evenly distributed across the U.S. Over the last 10 years, homelessness has become worse in many states, especially on the West Coast and in the Northeast, as seen on the map. Homelessness shelters are a critical service, but the University of Pennsylvania concluded that they impact the surrounding community. What we know is that there is 56% increase in total property and mischief crimes within 100 meters of the shelter. However, the security need does not need to extend beyond 2 to 3 blocks from the shelter. So what we see is the dichotomy in the need for service and the increase in property crime. Next slide. The National Retail Federation reported in 2023 that organized retail crime groups are increasingly recruiting houseless to boost. By no means is ORC just related to the homeless, though. The report states that the uncertain economy aids these criminal groups in attracting more vulnerable individuals, helping them to scale their operations. A significant portion of the boosters are typically addicted to drugs or are harmless, or both. And the money earned from boosting means their basic needs or supporting their drug habits. We have also learned that the newer ORC groups are more inclined to use violent tactics in addition to enlisting the homeless as part of these activities. A larger percentage of ORC groups have begun using firearms or other weapons, smash and grab, assault, flash mobbing, and violent threats against clerks or customers. Next slide, please. So the question is, how did we get here? Regardless of what your residential status is, shoplifting is a property crime, and shoplifters typically assume they won't get caught. Loss prevention has improved dramatically over the years. It is imperative that retailers have an understanding of their state and local laws. So questions such as, does your state have an organized retail theft statute? What is the store's policy for reporting thefts? Do they trespass? Some asset protection can't leave the sidewalk. Some can't follow. Some stores can't go hands-on. Also, do retailers have the ability to do online reporting in your area, which can improve law enforcement understanding of the problem? We also see that frequently stores have very high reporting thresholds, which makes it difficult to get to the monetary requirements for organized retail theft charges. And nationally, we are seeing an increase in violence, so many are allowing thieves to walk out to protect their employees. During the pandemic, most jails were not taking property crime custodies, which meant the suspect would get a ticket and was allowed to walk away. Although this has changed minimally, the lack of jail spaces, shortage of law enforcement, and rules due to the pandemic, the person who may have been stealing just to eat is not provided the services they could have gotten when taken to jail. Locally, we saw a major Nike store shut down due to the high level of thefts. We have since seen a shift in other jurisdictions being victimized. Task forces allow for continued investigations and prosecution. Prosecutors are inundated with horrific crimes and those take precedence. Most property crimes end up on a clerk's desk, and they read so many reports they don't see the patterns to link the frequency and dollar amounts of the shoplifters. In Oregon, there is a deep shortage of public defense attorneys, which means that incidents may never go to court. And although this may seem like it is helpful, the houseless person may not get offered drug treatment or other services which could ultimately improve their lives. Next slide. So I've talked a little bit about a booster, and just to give you a basic understanding of what a booster is and how they operate, we can see that a booster can be or is often a houseless, addicted to drugs, or has some need to get to money quickly. So they have a need to begin stealing. That booster identifies high resale items such as DVDs, Legos, laundry detergent, baby formula, and so forth. And then they target them at specific stores. The booster then steals those specific items, and then they either sell them on an online marketplace far below market value. They sell to an individual for quick cash. They trade or sell defense for cash or drugs for pennies on the dollar. And most often those fences operate a brick and mortar location or they sell online. Subsequently, these items are purchased online and sold to people internationally for well below market value. So I'll say, if it seems too good to be true, it probably is. Next slide, please. And this is a video.
A new bill to crack down on retail theft in Oregon is headed to the governor's desk. Under the bill, anyone convicted of organized retail theft could be sentenced up to 2 years in prison. That would apply to thefts involving more than one person, and if $5,000 or more in merchandise is stolen over a 6-month period. The House passed the bill with a 51-to-1 vote. It now heads to the governor's desk for final approval.
So as seen on that video, in 2023, Oregon passed new legislation which brought more teeth to the shoplifting statutes. It also brought a new retail theft unit to DOJ. As part of that unit, we focus on large-scale organized retail theft cases involving multiple counties, states, or even countries. The changes in the law allows us to go back 180 days for charging versus 90 days, which increases our ability to prosecute and incarcerate offenders. Next slide. So obviously there are a plethora of ways we can better combat retail theft, specifically addressing the houseless epidemic. Crime can adversely affect several aspects of retail, and just like Dawn mentioned, that's a shopping experience, customer traffic, and employee performance. To combat unsafe or negative behaviors in a retail setting, retailers are encouraged to use CPTED, which is crime prevention through environmental design. The technique includes surveillance, access control, territorial reinforcement, and maintenance. more than a dozen communities across the U.S. have implemented programs like LEAD, which is Law Enforcement Assisted Diversion, which diverts people with frequent, low-level offenses into community-based treatment and support services, including housing, healthcare, job training, treatment, and mental health support. It allows law enforcement to redirect offenders to community-based services instead of jail or prosecution. The goal is to prevent recidivism, which supports retailers and the person enrolled in the program. Research found that deployment of mobile surveillance units decreased the number of violent incidents and the general fear of crime. Also, you can participate in groups. In Oregon, we have something called ORCA, which is the Organized Retail Crime Association of Oregon. Most states have a similar type of program. They allow retailers and law enforcement to share information, attempt to identify, and overall patterns and trends. So in conclusion, law enforcement wants to help, and they are there to support retailers and, more importantly, want to help people be safe and healthy. But many departments can't be the frontline defense. So cooperation and crime reduction techniques by retailers can assist in customers and employees feeling safer and getting the houseless individual into community-based programs to hopefully afford them a better chance at a healthy life.
Thank you, Kara. Our next speaker is Laura Ellsworth. Laura has been with the Council for the Homeless for more than 6 years, working as their public policy and engagement manager. She has spent her entire career working in the nonprofit sector and has extensive experience with advocacy, public policy, and community engagement around homelessness, healthcare, and organ donation. Welcome, Laura.
Yeah, thank you. Hello, everybody. Thank you so much for having me here with you today. It's my pleasure to speak with you all about what we are doing in Clark County, Washington to support the most vulnerable residents in our community to try to help them resolve their homelessness and to help our entire community understand and cope with the impacts of having neighbors and community members experiencing homelessness so visibly. Next slide. Yep. First, I just want to start off by briefly sharing what Council for the Homeless does. We are, in essence, the hub of the homeless crisis response system, also known as a continuum of care. And this is a HUD-defined term for communities across the nation that receive federal HUD dollars to address homelessness, and they can be individual counties, metro areas, or even wider rural areas that cover multiple counties. But most essentially, COCs administer services through coordinated entry and track data using a nationwide system called Homeless Management Information System, or HMIS. We are an independent nonprofit agency that was established through the foresight of our local housing authority, the City of Vancouver, Washington, which is our county's largest city, and Clark County, Washington, in 1989 to address the growing issue of homelessness. So for those not familiar, coordinated entry is a single point of entry that allows for a no wrong door approach to services for people experiencing the crisis of homelessness. It's one place for people to call or to go to begin to engage in programs and services to resolve their homelessness. HMIS is the database that we use, as do other COCs across the nation, to track our participant data, programs, services, and outcomes. So we convene and collaborate with and coordinate 39 partner agencies with services across the spectrum of need and more than 300 individual HMIS users across the region to work with folks to meet them where they are to address their homelessness. Next slide. So we have had a pretty significant increase in homelessness, especially unsheltered homelessness, over the past several years here. And this is in direct correlation to the increase in housing costs. So when we ask people the reason for their homelessness, the top 3 reasons listed here are seen here. This is an opportunity to share something important with you all that I cannot stress enough, which is that mental health and substance use disorder are not the primary reasons for homelessness, but they are the primary reasons people remain homeless. They are the most visible consequences of being homeless for a long time and are likely the most common aspect of homelessness that you will witness as business owners and emergency managers. However, chronically homeless individuals are not even close to the majority of people who experience homelessness, and in fact are only about 10 to 20% of the overall population in any community, but they are the face of homelessness. So in 2018, when I first started working for Council for the Homeless, a one-bedroom apartment averaged about $1,400 a month here in Vancouver. And now it's about $1,600 after reaching a peak of about $1,700 last year. So we also here in the Northwest have an extremely low vacancy rate and a housing supply crisis, especially for people with low and very low incomes and no incomes. So in a nutshell, it's really expensive to live here, and when you have high housing costs, you have higher rates of homelessness. When you saw that map earlier of the parts of the country with the highest rates of homelessness, those are also the parts of the country with the highest housing costs. And in fact, you need to earn a really high wage, double that of minimum wage, to afford a one-bedroom apartment here. So getting into what I came here to share with you today is our community toolkit. It originated as the business toolkit after we saw something similar in San Diego, California at a conference. And at the time, unsheltered, chronically homeless individuals were mainly concentrated in our downtown area and impacted the small businesses there. We actually didn't until just a few months ago have a grocery store in our downtown core. So initially this was developed with small businesses in mind. And as we were creating a toolkit for our community, I wanted to get feedback about what kinds of information was most helpful. So that was the first step, was kind of doing a business owner downtown core survey. And it was really becoming evident that as chronic homelessness increased, so did the interactions and encounters with business owners and customers. And since small business owners are very likely not trained mental health and substance use social workers, this felt very overwhelming and scary for folks. So our goal was to provide some clarity around what services were out there, some basic do's and don'ts, and who to call, and importantly, when to call for help. The idea was to provide copies of this toolkit for businesses to have available in an easily accessible place for staff so that they could quickly refer to and use if they found themselves in an interaction or they just weren't sure what to do next. So we started this portion of the toolkit with the intention for it to be a quick reference guide for who to call. We have a wonderful partner with our City of Vancouver law enforcement, peer support, social services team called the HEART team. And they unfortunately are limited to only serving within the city limits, but having this team of folks really has been tremendous for reducing the trauma of interacting with law enforcement for people experiencing homelessness, especially for those with severe trauma, mental health, and substance use disorders. And our goal really is to help people recognize that 911 is not the first best option or the only option for people to call, oftentimes. So I'm going to review each section of the toolkit just briefly. This is available on our website. You can download a printable copy anytime, and I think even it was provided in some packets for everybody. But we really just wanted to start out by providing some basic guidance around how to help somebody, that there are resources in the community, and we've got pointers listed here for folks. One of the things that I'll highlight is the Council for the Homeless Coordinated Outreach staff. We have outreach workers across the county who go out regularly and just find people and talk to them and start to build trust and help get them engaged. And we also have a resource guide, which is our most visited page on our website, and it has social service resources for across every category for folks across the county. So good to know that that's out there. So if you own a business, and this is what we heard was the most common scenario for folks, you know, we wanted to provide some guidance for folks around what to do when. And so it's important to know that, you know, these are all things that trained staff are familiar with, but when you're not used to working with people in this situation, it just feels overwhelming and unfamiliar and scary. So our hope was really that just by spelling this sort of thing out, it demystifies things for people and just really brings people back to the human aspect of folks experiencing homelessness. And so then we wanted to provide some basic do's and don'ts, which, you know, it may seem like a no-brainer when you look at it, but, you know, some things on here may not be. And the goal was to sort of like just help people organize their thoughts and response based on the situation at hand, to help them determine real safety threats versus things that just seem scary, and to let them know, again, that there are places and resources out there to refer people to. So here's some don'ts, and I feel like this is like some of the most helpful information. There's a lot of gray area when it comes to interacting with folks, and we are all human and we all have good days and bad days. And one of the things that I tell people most often is that you need to know yourself and your own energy reserves on any given day. You're not a social worker. You are a person going through life with your own stressors. And one day you might have all the patience in the world to sit down and really engage with someone, and then next you might not, and you just might want to call 911 and just like make it go away. And that is normal. And the hope is that we can help reduce trauma for everyone involved by knowing the right people to call that will provide the most trauma-informed help for folks. And you know, we're never going to have a number for people to call and have magic workers just come in and swoop people off and take them into shelter and resolve their homelessness immediately. And that is really hard when you're encountering somebody with a tremendous amount of need and vulnerability on a 36-degree rainy day. So it's not easy stuff. There is no real 911 for homelessness, you know, in that sense. So it takes a long time to build trust with people. On average, it's 17 positive interactions to build trust with someone who has just repeatedly been let down over the years by the system, asked for help, told none was available, and then consistently re-traumatized. Another common scenario that we heard from folks, and just that they wanted help with, you know, planning out what to do regarding, you know, mental health symptoms. You know, the thing about folks experiencing homelessness is that they are oftentimes experiencing mental health symptoms, substance use disorder, and they're experiencing it in public. And there are plenty of housed people who experience those same things, but they have the dignity of experiencing those things in private. So it just, again, contributes to the stereotype that this is an issue for every person experiencing homelessness. So again, we just refer people back to that quick connect, who to call, and just, again, try to help people think through this scenario. And so again, just putting things into context, here's what to keep in mind: working to reduce stigmas, dispel myths, and help people understand what is available and what is not available. That's the key. We want to provide community with information so that they have a reasonable level of expectation about what can be done. And the bottom line is to remember always is that most people who are experiencing homelessness have asked for shelter or housing repeatedly and been told that there isn't any. So you can see here, we always encourage our community members to learn more on our website and our social media channels. Those are kept very much up to date. And here you can also see the download button for the toolkit that is on our website. We do keep this updated often, which is why we mainly now just have folks use the electronic version. But since 2019, when we introduced the toolkit, you go to the next slide, we have printed and distributed about 1,000 paper copies. And like I said, you know, we do keep it up to date as frequently as we can. So thank you very much. And next slide has my contact info, and appreciate the opportunity to share with you all today.
Thank you, Laura, for that wonderful presentation and wonderful resources. Our next speaker is Dr. Jillandra Rovaris. Dr. Rovaris is a psychologist with more than 35 years of experience working to improve the mental health of students. She served as Assistant Vice-Chancellor, Executive Director for Student Health and Counseling Services at UCSF, Director of Santa Clara University, and Executive Director at Tulane University, and taught psychology at Xavier and Dillard Universities. Go HBCUs! And freshman first year experience at Tulane University. Dr. Rovaris served 5 years on the Louisiana Board of Examiners of Psychologists and currently serves as Assistant Vice-Chancellor and Provost, Executive Director of Student Health Services and Counseling Services at the University of California, San Francisco. Welcome, Dr. Rovaris.
Good morning. Good morning. I am here with Stephen Robinson. Can you advance the slides to, yeah, so you can advance one more? Okay. Again, I am here with Stephen Robinson, who is a guru in the supply chain field, and together we have combined our resources to partner in an innovative way to meet the mental health and the medical needs of the homeless population and to meet them where they are. Next slide. That's our mission. Next slide. We can move forward. So in partnering to meet the needs of the homeless, the population of people facing homelessness face unique challenges in accessing healthcare. And at I Will Till I'm Well, partnering with Steve, we have via telehealth can effectively bridge the gap to help persons who are homeless and who are houseless. First, let me address a few requirements that will be true for any services that are being given via telehealth. Businesses should support local shelters and should always be encouraged to incorporate telehealth services into those shelters. All individuals who are homeless or houseless will need to have access to a physical location where treatment can occur, and preferably in private rooms, so that they can feel free to express whatever it is that they are struggling with or whatever their challenges are. And in doing so via telehealth, they will also require electronic devices such as computers or cell phones to connect to a healthcare provider. And ideally, proximity to a pharmacy where they can pick up any kind of prescriptions or medications needed for timely access. And then for optimal support, having on-site staff to facilitate or to coordinate or assist with paperwork, including their consent forms, to engage with a therapist or to engage with a medical provider that's consistent with HIPAA, and any type of enrollment or referral programs like Medicaid or Medicare, or just some local resources that can significantly improve their access to healthcare would be necessary in the facility. And in our network, we provide medical and mental health care to people via these services, via telephone, via video consultation. And so these sorts of equipments are absolutely necessary. Volunteers are always welcome, and we encourage volunteers to be present at the site, but we are a tech company and can telehealth enable any local shelter. We can telehealth enable a shelter for you, we can telehealth enable a shelter with you, or we can telehealth enable a shelter to enable you to do it yourself. So we have a national platform of over 5,200 medical doctors and a national platform of over 25,000 licensed mental health therapists who are available to communicate in different languages, but mainly English and Spanish. And what we found is that according to SAMHSA, there is a 4.5 million shortage of mental health therapists in the United States. And as Laura just mentioned, mental health is not always the reason why people are homeless. but it can be the reason why they remain homeless. And so it is important that we make sure to treat mental illness and not criminalize it. And so it's important that we work together to do this. So in our program, we have mental health professionals. Again, they can speak to persons in English or in Spanish. And what we have is in the moment care as well as session care. So we can diagnose any ailments. We can you go to the next slide? So we help persons to cope with stress and anxiety. There's lots of trauma and PTSD related issues that can keep persons in a homeless state. We work with persons in the moment. So if someone has an experience or an attack, an anxiety attack in the moment, they can contact or pick up the phone or connect with a therapist in the moment. It could be 3 o'clock in the morning, 5 o'clock in the afternoon, whenever it is, they can connect with a therapist immediately. And then we can offer ongoing sessions with a therapist, and that's clinically determined sessions that are clinically determined by the therapist. So it could be 5 sessions, it could be 10 sessions, it could be 20 sessions. So we offer both types of care. The next slide. We come with, again, our licensed physicians, where there are over 5,200 physicians. We also have 2 different models. We have an urgent care model, and we have a primary care model. So we can deal with urgent issues, or we can deal with long-term care issues. Next slide. With both of these models, we diagnose, we treat ailments, we can write prescriptions, we give recommendations, and these are just some of the situations or conditions that persons have brought to us. GI issues, eye problems, skin problems. We deal with all of that and are capable of writing prescriptions, which is why it would be appropriate to be near a pharmacy. Next slide. We also offer communication with specialist experts. So if you have an issue that is pertaining to your dental work, or you have a cavity, or you need to speak with a registered dietitian, we can put you on the line via an email with a specialist, and you can talk to an expert about that. And then your response will be met, or you'll be met with a response within 24 to 48 hours from an expert. Next slide. And because navigating health insurance and understanding health insurance can be both difficult to manage and difficult to navigate, we offer the services of working with a care coordinator who can help to navigate medical billing, who, if you need services with someone in a local, in your local environment, we can obtain referrals to your provider in the community. We can help you to find less expensive options than options that are in your community. You can get advice or a second opinion. We can talk to you about your prescriptions. We can have other medical experts at your fingertips where you can ask anything that you want. And these patients must be sponsored by the shelter with a budget for mental health or Medicaid eligible in order really to engage in our services. Next slide. And then finally, because pets are an integral part of our families, and we've come to love them very much, we have a host of veterinarians available for pet consultation. So this is a consultation service that we offer. So you can consult with a veterinarian in real time via the telephone or via a video about any ailment that you are seeing with your pet. And once the consult has been scheduled, the vet will typically phone you back within an hour. So you just put in that you need a consultation with the vet. They will help you to understand, well, yes, you should bring your pet in to see your local veterinarian, or here are some tips to manage what you're seeing, and there's no need to go into the office visit for an office visit. And as a bonus, we offer a pet drug savings card, where a prescription discount can save you up to 75% on any recommended pet med that is recommended by the vet at over 68,000 participating pharmacies. Next slide. So additionally, we have a lot of mobile app, and the mobile app offers a lot of different experiences. Next slide. So the mobile app experience could be for individuals, it could be for families. I do want to say that our services are for families up to 8 people living in one place or living together in a shelter. If they normally are in the same household, all of the services are available to every member of that household. Next slide. And we also have apps for groups. Next slide. This is just the last slide. If you want to learn more about I Will Till I'm Well, please contact us at info@iwilltillimwell.com to discuss our packages. We need local businesses to help us to build more telehealth capability at local shelters. We need you to donate your time. We need you to advocate. We need you to help us to help people to get the help that they need. And so with that, I will turn it back over to Kenya.
Thank you, Dr. Rovaris and Mr. Robinson, for that wonderful presentation. Our final speaker for today is Julissa McWashington. Julissa serves as the Senior Manager of Global Social Impact for Starbucks. Julissa has been with the company for 13 years. She's worked across various teams, including global coffee, marketing, food, and Latin America. Currently, she leads the Community Resilience team, overseeing local outreach worker programs and community resiliency funds nationwide. Passionate about community service, McWashington serves on the boards for ALPFA and After-School All-Stars. She also co-chaired Starbucks' Hora Del Café. Welcome, Julissa.
Thank you, Kenya. Hi, everyone. And can I just say how fantastic all of our presenters have been? Don, Laura, Kara, Dr. Jill, Stephen, just amazing. Thank you for what you have giving us. So I'm excited to talk to you and share a little bit more about what we are doing at Starbucks. So again, Julissa McWashington, my pronouns are she and her. Grateful to be here with you today. You know, I do sit on the social impact team for Starbucks, and I lead our community resiliency portfolio. For me, first, again, honored to be here. And I think with all of you who are architects of positive change and keeping our community safe. So at Starbucks, we deeply value cross-sector partnerships. We recognize that together we have an opportunity to really bring together what our unique assets are and the resources to the table to drive meaningful change. So for Starbucks, our social impact ethos stems from our mission statements you can see here. With every cup, with every conversation, with every community, we nurture the limitless possibility of human connection. Like that's literally in our mission statement. So as we move into the next slide, you know, we at Starbucks have enduring belief that our corporations can do more for our people and the communities that we serve in. So for us, we have what we call a community promise that I get to lead with a bigger, broader team, which means to contribute positively as we aspire to do this through our partners, which our partners for us is our employees, our stores, and our communities. You know, for us, it's whether it's building sustainable stores to scale, pioneering ethically sourced coffee, or designing innovative benefits for our store partners and our partners across the globe. We believe that the pursuit of doing good is not in conflict with the pursuit of profit. You know, Starbucks employs over 200,000 partners in the US alone, and we have over more than 10,000 company-operated stores in the US. So we're embedded in every community across the country. And so for us, we are really about supporting and supporting those who face barriers to opportunities. And that's part of why I'm here today, to share a little bit about what we're doing with our unhouselessness neighbors to create, the safe, welcoming, and just communities. So as we move into the next slide, we really began our outreach worker program back in 2020 to support our store partners, our employees, in selected stores by connecting them to what we call outreach workers, who bring that hyper-local expertise in supporting customers with those critical needs, which a lot of you've been hearing of what that looks like and why that is happening. Our outreach teams support customers who are experiencing homelessness, mental health situations, and substance use disorder. So for Starbucks, we aim to increase what our partner or employees' confidence and support system in creating a welcoming third place environment. Starbucks is known for the third place, which a lot of our retailers are across. But for a lot of these customers or community members, it's their first place. So we know that Starbucks, we had an opportunity to lead differently in our communities by connecting these customers, and we call everyone a customer that comes into our doors, to the resources they need, meeting them where they are, in partnership with nonprofits that are doing this work and really providing key service, critical services in those organizations. And just, we've been at this again for over 4 years. We started small to go big, but to share the impact of this program that we lead across the 8 cities, we have reached over 43,000 individuals. Now we're at 45, so it keeps growing, which is amazing. And out of those, over 7,900 have been referred to a stabilizing program or service. So that means that they've been connected to a home, to whether it's housing, whether it's to a mental health facility, whatever it may be. That's amazing. Not just Starbucks wins in that situation, that whole community wins. And so what can we do more together? And then through this program, we're serving over 150 stores. And again, our outreach workers are providing anywhere from food insecurity support to hygiene kits, case management, outreach for those who do know the outreach workers portfolio. It can be, just having a conversation to all the way through a case management, depending on what their need. So let's go ahead and move to the next slide. I did want to share a little glimpse of how this shows up for us in our stores. As you can see here, we are in these 8 cities, and where we really wanted to focus on is, where are the areas that we are seeing a high influx of homelessness, look at our portfolio of stores, and then how we able to really go small. So we started in LA and DC to be able to expand to other cities. We do identify and know that there are many more cities and areas, even in rural communities, that could use this, and so we're learning to really how to think about what the expansion looks like. So the outreach services that are provided, we work with a nonprofit in each of these communities, a different nonprofit. It's not a national because that does not exist, unfortunately. If you do know one, let me know. But we really look for a localized nonprofit who's already doing this work. Each city has about 2 to 3 outreach workers who circulate in our selected stores, engaging with those customers, building rapport, providing resource navigation, enrolling them in stabilizing services and programming. We work really closely with our asset protection team, because they're vital to this. They are a key cross-functional partner for me to understand what are the right cities, what are the correct stores to make sure we're bringing in, who's the right partnerships to think through to support these efforts. The other piece that comes with outreach program is the in-store community resources. We just heard a lot from different presenters here of different community resources, like the toolkit. That's amazing. So we know a lot of times the nonprofits already have these resources at hand. So what they do is provide those same guides and resources to our stores. So when they're not in our stores, doing outreach, our partners, our employees have those resources to be able to give to customers who may need them, which is amazing. And we've started to see that really show up really well. Also, our employees feel like they have the tools that they need to better support. They want to support, right? They want to be empathetic and compassionate with them, but also giving them the things that they need to be successful. The other component of this is training and education, which is huge. And we just, I just learned so much more from Laura, Kara, even Don, of how can people and individuals be homelessness? What does that look like? Really the person behind the situation. So with us, our nonprofits really provide that training education that complements our de-escalation training. So everything from homelessness 101 to trauma-informed care, mental health 101, is so important and vital for our store partners to be able to have that additional knowledge as when they are encountering those individuals. And what we started to see is that a lot of our district managers and retail leaders are starting to use this training and education, not just to the stores participating in the program, because it can be valuable to all the stores in that market, which is phenomenal. The other piece is obviously a cross-functional support. We've been kind of listening again, how everyone can play a role. So internally for me, this is not successful unless my cross-functional team in Starbucks across the enterprise is supported and executing. So we're talking about our global security resilience team playing a role, our asset protection team, our government affairs team, our retail teams. We all have to be connected, all have to see the same goal. We all have different scopes of how we're supporting. And so that's what's making it successful, is that we're all aligned and equipped to support, and knowing that we all have a hand in how we're supporting our stores and our communities. So that's been amazing. And then obviously we work with, outside externally stakeholders. We work with government elected officials. We work with law enforcement, other crisis response teams, mental health, clinics and entities, because I think, again, how can we support together, especially in those communities? And I think the last piece about this is really the engagement we do, the community engagement. So our nonprofits and our outreach workers really embed themselves in supporting our community engagement volunteers. So that we have, and they show up as well to be able to support. So we have obviously coffee with a cop is one of those big things, but we try to do a coffee with outreach worker. There are different services and resources pop-ups that we host in our stores and in the community. And we have National Night Out as one of those components too, and many other community activations that our outreach workers are there to support through those volunteer opportunities. So over to the next slide. This is just really, for us, this program, again, is only successful if all the community members that are involved. You will see testimonials from an outreach worker here, a district manager, and a community member. We cannot see the success unless it's executed on the ground, that our retail teams feel like it's it's solving some of the needs, it's solving how our store partners, our store employees are able to really execute and feel like it's a valuable program. We also, with our nonprofits, we had to make sure that our nonprofits felt like we were meeting them where they are, that we were not trying to come in and try to do something totally different, but really already integrating what they do. They're the experts. And so there was a lot of communication, a lot of tweaking back and forth. And so these are just some of the testimonials you see here from the outreach worker, our Starbucks district managers, and then obviously a community member, which is an unhoused member that we were able to serve through this. So I can talk about this all day. There is a video that's going to be queued up in a minute that's going to showcase what this looks like for us through the lens of a community member, through the lens of our store manager, and through the outreach worker themselves. And so this is a video that you're going to see from one of our partnerships in Chicago. And so hopefully you enjoy. Thank you.
We could ignore it, kick people out, but it's just going to keep causing frustration for partners and everyone else. Or we can just start to have conversations and begin to help people. Thresholds provides human services to people to help them get to wherever they need to be, whether it is just a pair of shoes, shelter, food, showers, basic human services.
When I saw that Starbucks was doing an outreach program, I had to get in. I wanted to get in at the floor. It was really interesting. I am part of the Starbucks outreach program, a program where nonprofit and for-profit come together to address a common issue.
I'm like, why would Starbucks do something like this? But then as I've come to know, this is the mission of the program. I was sleeping outside, and I didn't care anymore. But once I made the connection with Starbucks, and particularly the manager, and then the coordination of the outreach program, I began to start feeling a sense of worth.
Starbucks offers not only the logistics where it's a welcoming environment, people want to be in there, having a conversation over a cup of coffee is the norm in there. But they provide the support that we need to help get people from where they're at to where they need to be. Cindy's amazing. One of the biggest things we do is to meet people and get them to trust us. She does that. Frederick came to us right at the beginning of this program, and the manager of the store at the time told me about this gentleman, and she was like, there's just something about this guy.
Joy has been a godsend to me. She never gave up on me. She always had an encouraging word for me. And I'm just so grateful, to be a part of the program, and then to see the outcome that I've had. When I first walked into my apartment, I thought it was just, amazing, because I was like, I finally have arrived.
The thing is as great as this program is, it's just the beginning. Much more needs to be done. If this program expanded and other organizations, both nonprofits and for-profits, kind of looked at what we've been doing and put their own touch on it and expanded it and made it work, we could all work together and make an even bigger impact.
So with that, I just want to say thank you so much again for having me. Again, this is an approach that Starbucks works for us, is a way that we can give back, be part of the solution. And it's not perfect, but we feel really good about the partnerships we have encountered, we have put together, we have nurtured. And, I look forward to all of you to reach out. So thank you.
Building a different.
Thank you, Julissa, for that very informative and very moving presentation. A special thank you to all of our presenters for today, Don, Kara, Laura, Dr. Rovaris, Stephen, and Julissa, for sharing your wisdom and experience with all of us. We hope the information shared today will help you and your organization become more resilient. At this time, we would like to give you the opportunity to ask questions. You can type your questions or comments using the Q&A function located on the top right-hand corner of your screen. John Hanian, the Public-Private Partnership Program Manager for Idaho Office of Emergency Management, will facilitate the Q&A session. John, over to you.
Thank you, Kenya, and let me first thank all of our presenters for helping us all get a better understanding of these issues that many of our businesses are confronting, and just absolutely blown away by all of the innovative programs. I've learned a lot. I hope our audience has. Our first question goes to Don Lynn of Albertsons Companies. Don, you spoke of loitering and vagrancy and the impacts it has on businesses. So the question is, how do you empower and even educate your store managers and employees to make a determination when an individual is considered vagrant or is loitering versus someone that may be just dealing with mental problems or doesn't meet the classic definition?
Sure, John. It is exactly that. It is training, it is awareness. And I know in my company, we do limit who can do the interactions, and we limit it for the reason that we want a consistent approach in every one of our stores. We have over 2,400 locations in 35 states and DC. So what we do in one, we want to do someplace else. And that does come from awareness and training. I'll share some 3Ds. So obviously those people that are empowered to engage with individuals, we're teaching de-escalation techniques. We actually teach de-escalation to everybody, but even more so and at a deeper level to those empowered. The other 2 Ds of the 3 Ds is 1, disturbing or destruction. So is it something that is disturbing someone versus destruction? And by destruction, I mean, are they harming others? Are they harming themselves? Are they harming property? And you have to take appropriate action for those different levels. But, you know, it doesn't happen by accident. It doesn't happen by accident that many of us that are practitioners on this call, we've learned this session and we've learned these different things. The more we understand and learn, the better off we can do and the better off our solutions. Back to you, John.
Don, thank you. You know, these types of issues often create challenges, and one of them is it forces employees, managers, and others to sometimes make very tough calls, and that is part of our next question to Laura Ellsworth. And the question is, how do you know the difference between disruptive versus dangerous behavior? Because, you know, oftentimes dangerous begins with disruptive and then escalates, right, Laura?
Yeah, thank you for the question. And actually, Don really nailed it. Again, like I would start with training staff. I really recommend a training by Ryan Dowd. Ryan used to operate the second largest homeless shelter in the state of Illinois, just in the Chicagoland area. And he has developed a training curriculum that was originally developed for librarians, because libraries have also become, you know, just frontline with working with folks experiencing homelessness. And so really recommend signing up. He sends out like I think it's a daily or a weekly little email digest that he'll share little bits and pieces and tidbits. And then also he offers like real trainings, and there's a book, The Librarian's Guide to Homelessness, but really it can apply to any kind of, you know, a community third space that is people's first space, to to quote our presenter from Starbucks earlier. So yeah, I think just naming it with employees, recognizing that this is, you know, homelessness is a community issue. It is not just up to service providers or law enforcement anymore. It's up to all of us, and these are our neighbors, and we all need to, you know, learn how to. It's just a part of our daily life now. So. I think also one little, if I could offer, like, this is something that Ryan Dowd says a lot and that I really stood out, something that I learned from him very early on, which is, you know, the thing about escalated situations or, you know, conflicts is that fake fights are loud and slow, and real fights are quiet and quick. So if people are kind of yelling and standing far apart and making a big scene, like those typically are going, as long as they're not escalated, are going to stay, you know, it's just that. Whereas the ones that are truly, you know, a threat are quiet and quick. So, so there's ways you can kind of prepare there.
That's terrific. And while we have you, I'm going a little out of order here, but a question about copies of the community toolkit. Are they publicly available? If so, how?
Yeah, on our website, which I believe is all in the presentation materials, but it's councilforthehomeless.org, and in the About Homelessness tab. So you can definitely download a copy of that, and maybe you can develop one for your community locally. So yeah, you can work with your local homeless service provider agencies.
No, that's terrific. We love the toolkit, and thank you very much, Rachel, for the question. Our next question goes to Julissa, and it's about the innovative program Starbucks initiated. This question is also from Rachel. Julissa, how do you communicate your programs to your employees and store partners? do your employees know all these great things that you guys are doing? And as a corollary to that, how is this program funded? How is it sustained, and how do you pay for it?
Great questions. So the first question, for those participating in the program, obviously they're already selected, our district managers, our regional directors, as well as asset protection team plays a role in that. So what we do from the program inside is to make sure that there's awareness and they understand who's coming into the stores and the types of things that outreach workers will be doing. We do what we call a kickoff and a launch. And so it's kind of like a training. They get to know the outreach workers. They understand what the outreach workers' roles are, what they are not. And then what we do is set up one-on-ones with each of the store managers to do a community walk. And so for a lot of our store partners, they do not live where they work. And so a lot of times they may not know what's in the vicinity or what is in that walking block of their communities. So the outreach workers take them and say, you know, a lot of them, you might have a methadone clinic, you might have a shelter, you might have a place, a food bank. So just to understand the dynamics of who may be coming to your stores and what resources. So they do a block walk. They kind of identify those different resources that are around or the different dynamics that are happening in their community. And then with the district manager that we put as point of contact has an ongoing meetings with all of the store managers participating, and obviously through the trainings as well. So that's how the one way our partners know about this. To be transparent, we could do a better job of like how to all know. So those in those communities, those 8 cities, they know about it. I think when we think about it at a national level, we really haven't gone nationally with this program. Obviously, I speak in a lot of forums and conferences, and that's one way. And a lot of times we invite our store partners to be able to join those to understand more about the program. The second question around how this is funded, one of the things for us when we started meeting with the nonprofits, you know, we wanted to really partner up with someone who already had these expertise, already had an outreach team, was already doing outreach workers. We're not the experts. We do not know how to navigate this. So, but we also didn't want to take from those resources that already live. So we pay, I have a budget that pays for the program in each of the cities. So we ask each of those nonprofits, in addition to the outreach teams that they do have, they hire outreach teams for the Starbucks programming. And so, like I mentioned in my presentation, usually it's 2 to 3 outreach workers, depending on how big. LA, I believe, is really, we have about 3 outreach workers, and Seattle is really big, a bigger team. And so we pay that from my budget to make sure that our nonprofits are continue to do the roles, right, and the outreach with their city, because they're funded by the city. They may be funded in other ways, and this program is funded by us to make sure that we're continuing the impact that we want. And obviously, they learn from one another. They're part of the bigger team, so it's a really great way to showcase our commitment through investment as well. Thank you.
Lisa, that's terrific. Thank you so much for that. I love this next question, and I'm going to pose it to the whole panel because I think all of you can speak to it. And it was asked anonymously, but it's a great question. How do we start having these kind of conversations about this topic with our children? And Kara, I don't know if you would like to start, but this is such a, you know, it impacts our businesses. It impacts us through across our economy, but obviously our children see these things playing out in our communities. How do we begin to have the conversation about this?
Yeah, I mean, obviously I have a lot of knowledge coming from the LE side, but I'm also a mom. And so when I am talking to my child about it, I just continue to remind him that they are human beings and everybody deserves to be treated with dignity and respect. So, you know, we talk about the safety issues and being prepared and noticing your surroundings and paying attention to what you may see. And I think An earlier speaker addressed it beautifully when it was, are they loud and far apart? Are they close and getting touchy? Then those are all things that I think we can talk to our children depending on the age. I also had a little secret hand squeeze with my kiddo when he was little. It's like, hey, stay close. And then the second squeeze meant he was released. So I mean, just having those conversations, but just reminding our children that they are in fact human beings and everybody deserves to be treated with respect and paying attention to that. But we do have to be mindful of the safety issues and being aware of your surroundings. So that's where I would start.
Kara, thank you. Laura, how about you?
Well, I don't have kids, but I think that, talking to them in an age-appropriate way, like you would anyone unfamiliar with people experiencing homelessness, and just reminding them of the humanity, maybe asking some leading questions like, wow, what do you think it would be like to not have a place to sleep at night indoors? What about when you're not feeling well and you need to just like go to sleep in your bed? What would that be like if for somebody who's sleeping outside on the ground or in a tent? And just kind of like having critical thinking prompts at an age appropriate level. And again, just bringing it back to the humanity and reminding that, sometimes the behavior is due to, need and survival and not, and it's not criminal. And even though that our society does criminalize it. And then, of course, setting those right boundaries, like Kara was saying about, just personal safety and personal boundaries, and naming things using correct language, much like any difficult topic with young people. Recognizing that life on planet Earth is not necessarily the same for everybody, and it's not always safe for everybody. So
we've only got about 4 minutes left, and so I think we could go on that question for quite a while, but I think we have time for one more. And Don, this might be a question you can answer. We've been having trouble with a homeless individual who's been repeatedly trespassed or is trespassing. We've tried offering assistance and calling authorities, but the behavior persists. What advice would you offer, having dealt with this in multiple states?
Boy, John, that is a difficult question. I think that's one of the reasons we're here. And I heard earlier that someone made the contact about the number of interactions that it takes to get through to a program. But, I'm going to answer it by this way, because the other question is probably the same answer to this. You need to start off, of course, safety is always number one, but you have to be mindful of the needs of others. And it's kindness. And just because you didn't take care of it the first time doesn't mean that the next time you might not take care of it. So don't get weary of trying to do the right thing. I know in our stores, and we try to be consistent in our message. We always talk about how we're caring and looking out for the needs of our associates, which is what we call our employees, our customers, the community at large, and the planet that we share. They're all there, and I think part of it is internally it can be very wearing on your staff. So you need to take care of your staff, but you need to explain that it is not a simple solution. It may take some time, but if you're successful, it was worth the investment. So I know we're coming down to the end of time. John, I'll turn it back to you.
Don, that's great. That was a very, I wish we had more time for questions. In fact, I wish we had more time for this presentation, because that 90 minutes just flew. So let me end there, thanking all of our panelists. And Kenya, I'll turn it back over to you.
Thank you, John, and thank you all for your questions. We hope that you all feel empowered to go and be solution makers in your communities. And on behalf of the Public-Private Partnership Security and Resilience Seminar Series planning team, including our private sector, state, federal partners, and subject matter experts, thank you for participating in today's session. Please join us for our next session, Safely Leveraging Artificial Intelligence in the Workplace on September 12th at 9 a.m. Pacific, noon Eastern. Registration is now open. We wish you well, take care, and stay safe.